In our individual practice, we have several nurse practitioners and 2 attending physicians. The attending physicians are always the ultimate point of decision making for, is this patient a candidate for opiate therapy at our practice, or will they be discharged from the practice for some sort of aberrant behavior? If one of the nurse practitioners detects that there's some abnormality going on, whether it's an abnormal urine test, a abnormal pill count, some anonymous phone call, some combination thereof, or even abusive behavior by the patient, patients cursing at us and making threats, that sort of thing. This happens in clinical practice. The nurse practitioner who had that initial encounter starts what we call a discharge review. Basically, it's a simple document with 4 sections, 3 for nurse practitioners and 1 for the physician. I type the thing up, I send it to my colleague, one of the other nurse practitioners, who will review it, put their 2 cents in, send it on, and after 3 nurse practitioners have reviewed the information, it's then sent to the attending physician to make the ultimate decision of, do we modify their treatment plan by putting them into a high-risk treatment profile, or do we release them from our care? Now, it's the physician's responsibility ultimately in our practice, but to tell you the truth, there are some times when a patient has burned so many bridges with so many different practitioners that if the physician wants to continue treating them, they're going to have to do it themselves in person, and they're not going to do that. Usually they're busy doing other things. So at our particular practice, it's a matter of 3 different nurse practitioners reviewing the situation, the physician doing the final sign-off on what the process is going to take. And that takes some of the personal, I won't say grudges, but there are personality conflicts. Not every patient gets along with every practitioner. Fortunately, our practice has 7 nurse practitioners, so there's usually someone they can get along with. If they can't get along with 7 different people, they're not a good candidate for opiate therapy in the first place, because opiate therapy requires some degree of social responsibility. You have to be able to interact with people in a realistic, social way. If you can't get along with 7 different people, that's a real marker if there's something personality-wise going on that may not be a suitable candidate for opiate therapy in the first place.